Soldiers who've been back from a war zone for a few months actually have more mental health problems than when they first return. That's just one of the findings of a major Army medical study. Our medical editor, Dr. Paul Little, has more.
The first study, back in 2006, looked at the mental health of soldiers when they first returned from theater. This new study looked at the redeployment screens of over 88,000 soldiers who'd been back at home station for about 6 months. The results were unexpected. The second screen uncovered a large group with problems not picked up on the first screen.
Things happen fast over in the combat theater. It's only after a soldier's been home for some time and has time to think about what he's been through that some of these problems start to become something that weighs on his mind.
That something weighed heavily on the mind of Tom Williams, a veteran of both the Iraq and Afghanistan wars.
It takes time for the reactions to start, and it takes time for you to recognize that there's something wrong, that your behaviors are not just affecting you, they're affecting someone you probably love or care for.
There was a 17% increase in soldiers reporting PTSD, alcohol abuse, and major depression. But researchers say the good thing is the second study is motivating them to get help.
For the next 30 days following the screen, a number of other soldiers enter the mental health system. So something about the screening and training is actually encouraging soldiers to go get care.
Dr. Milliken said the first screen probably starts the process of looking inward. Then as the adrenaline pump from combat winds down, suppressed problems begin to surface. Dr. Paul Little, Washington.
The study also shows that the redeployment screening process helps soldiers confront problems directly by getting them to identify concerns, talk to professionals, and through peer-to-peer discussion groups.